Started. Let me just give that a second. Perfect. So, welcome everyone for our workshop today. And we are going to be recording for people who have registered that weren't able to join us in person today. Because I know we had a couple people reach out saying they were really interested in the topic, but that timing and all of those types of things weren't able to work. So, we're so glad to have everyone here. I'm thrilled to have with me today Kerri Myatt. Who is just a fabulous individual and a wonderful person, aside from the fact that she's an excellent practitioner. And we have a great topic for our presentation today on how to manage a pregnancy and maintain fitness and feeling great throughout that pregnancy using physical therapy and acupuncture. So really excited to dive in. In today's presentation, we'll talk about some of the changes that happen with pregnancy on the body, because it's really important to have a good understanding of how the body changes and what types of things to expect as you go through those trimesters leading up to delivery. We'll talk about some common pain conditions that occur during pregnancy, as well as ways to manage that pain, either through exercise or some other tips to help keep that pain at bay. And then I'll pass off to Kerri, who's going to talk about how acupuncture plays into managing pregnancy, both from a pain perspective, as well as some other fascinating uses for acupuncture. And then lastly, we'll talk about how to prepare for a really successful delivery. And that can be through a variety of different tips that both Kerri and I can share. But before we do that, I think it's really important that you have an understanding of really who we are, so that you can kind of get some perspective as to why Kerri and I are so passionate about this topic and helping women through this journey. So, my name is Kristen Wilson. I'm co-owner of Action Potential with Kathy Dixon. We are a physical therapy company with 2 locations, one in Glen Mills and one in Kennett Square. And in our practice, we treat a variety of different conditions, and one of those conditions being pelvic health and the management of both prenatal as well as postpartum care for pelvic health. And this has been a really fascinating part of our practice that we are thrilled to be working alongside other practitioners to provide some guidance for our women pre and postpartum, because we know that this is a really complicated journey to go through as you're having children. Personally, I have 3 children of my own, and I recognize definitely the changes that have occurred as a result of having those 3 kids, both while pregnant as well as the postpartum effects that have lasted significantly, beyond the years of them being a baby. I had pretty significant back pain after my 3rd son, and not until I learned a lot about the role of pelvic health did I have a great understanding of how to manage that. So this is definitely a topic near and dear to me, and I'm thrilled to be speaking on it today. And I'll pass off to Kerri so she can tell a little bit about herself.
Hi, I'm Kerri Myatt, and I'm a practitioner of Oriental medicine, also sometimes referred to as East Asian medicine, and traditionally trained in traditional Chinese medicine. So herbs, cupping, gua sha, moxibustion, and acupuncture. I do specialize in fertility and reproductive health. And that sort of naturally led me into treating a lot of pregnant women. And so obstetrics became something that I wanted to focus on and be able to, help my patients conceive and also help them have, a really nice pregnancy and help them through the whole journey and also postpartum. Acupuncture can really help through all those different times during pregnancy. And I also too was a Pilates instructor for many years before starting my acupuncture practice. So I've always been very interested in the body, in health, in exercise, and Pilates is I, as an instructor years ago, would help women while they were pregnant, postpartum, pelvic floor, all those things that Kristen's going to talk about have always been really interesting for me. And I am a mom of 2 boys, and have learned firsthand about how bodies can change during pregnancy and postpartum, and how just sort of a first-hand experience of what that's like and having issues, and how I was able to help myself, and also too understanding what help I wish I could have gotten if I'd known about it. So I think it's so great that Kristen is educating everyone and letting everyone know that there's a lot of help out there that a lot of women don't realize can be really great for them.
Absolutely. And for anyone out there doing the math between Kerri and I, that is a full basketball team. All right, so let's talk a little bit about changes that happen during pregnancy. So certainly many people already know that during pregnancy, we have significant change in our hormonal structure, and this leads to an increase in flexibility of the ligaments of the body. So we know that in the body, the ligaments are responsible for holding bones together, and these hormones start to relax those ligaments. And what this does is it allows our pelvic girdle to widen to allow this basketball-sized baby to pass down through the pelvic opening. Certainly, as we have that stretching occur, that's a really potential for an increased risk of pain at those areas where all of those ligaments join the bones together. Certainly, we have to be mindful of the fact that the body is changing in very, very dramatic ways, and the shape is changing. In addition to this, we have this significant overstretching of the abdominal muscles. And what many people don't realize is that the abdominal muscles play a very, very critical role in helping to stabilize the pelvis as well as decompress the spinal column. So when we overstretch those abdominals, particularly the transverse abdominis, which is the deepest of the abdominal muscles, as well as the diastasis rectus, which is the long muscle, the six-pack muscle of the abdomen, this can lead to a lot of instability in the spine and pelvis, which can cause pain. Many people have heard about diastasis rectus, which is the separation of the rectus abdominis muscle. It gets a lot of press right now, and it is definitely a concern, but one that is very easily managed with good medical care, particularly postpartum. We also know that the weight of the fetus, as it sits on the pelvic floor, is going to start to stretch out those muscles of the pelvic floor and essentially make them weaker and more fatigued. So you can see here in the bottom photograph, those red bands going between the two white bony structures, that's your pelvic floor. And its job is to act like a hammock and hold your organs into your body, as well as regulate all of your bowel function, bladder function, and sexual function. So when those muscles become very overstretched from the weight of the fetus over the course of the 9 months, that can lead to some significant changes in the body that stick around postpartum. So we want to be really mindful to manage that pain as well as that muscle function as we go through the pregnancy, and then especially after the pregnancy. Here's a great photograph of that diastasis rectus that I always like to include, since a lot of people have questions about what diastasis rectus is. But essentially, that muscle that runs up and down the abdomen and makes those little six packs is joined in the center by a very thick tendon, or it's almost like a glue that holds the muscle together. As the muscle becomes overstretched, it will start to separate mostly around the belly button, and it will start to kind of pull that muscle apart. Oftentimes after pregnancy, that separation will stay apart, and is often more of a cosmetic issue than it is a structural issue. After we have the baby, we want to make sure that the abdominal muscles learn how to contract and that we're able to support the spine. But that typically occurs most predominantly through that deeper muscle, the transverse abdominis muscle, which wraps around the stomach like a girdle. So while this idea of diastasis rectus is certainly an important one, it is definitely not something that is going to cause significant structural problems down the road. So what we want to do is be mindful that if someone has a diastasis rectus, that we train those underneath layers to be very, very supportive so that we don't have further strain on the muscle, especially if you're considering having additional children. Typically, the easiest way to tell if you have a diastasis rectus after pregnancy is to lift your torso off of the ground, almost like you're doing a tiny crunch. If you look down at your abdomen, a lot of times you'll see that you'll get like a little cone running down the front part of your body. It's called abdominal coning. And this is actually just that the inner part of your abdomen kind of poking through that separation. So that's usually the way that we test for this in the clinic, and then determine if we need to do more training for those muscles underneath. During pregnancy, we certainly see that there are 3 common pain issues that occur as a result of all of the stretching occurring within the body. The first one is pubic symphysis pain. This is when you have pain right in the center of your pubic bone, which is right here between the legs in the front part of the pelvis. It's right where the pelvic bones join. And that pain is often very, very sharp. People will liken it to feeling like they've gotten almost like stabbed with a knife right between the legs, just above the vagina. It usually occurs with things like rolling over in bed, or anything that requires you to stand on one leg. So that could be going up and down the stairs. Maybe it's stepping into the car or into the shower over the bathtub, or getting up and down from a very low surface. When someone has that pubic symphysis pain, it's typically because that pelvis is pulling apart at the front part just above the vagina. And it is a normal part of pregnancy. So oftentimes, to help mitigate that pain, we'll teach a lot of pelvic or abdominal stabilizing exercises, and we'll chat about those on the next slide. An additional option is to use a pelvic support belt, which essentially is a wide band that goes around your pelvis and helps to cinch those bones together. While that is a really wonderful way to manage the pain, I do caution my pregnant moms not to use it too much, because it actually can cause the muscles to become too relaxed and too weak. So it's a nice tool. For instance, if you're someone who has another child that you have to be able to pick up and that causes pain, or maybe you're someone who works on your feet a lot, it's a great way to help create some stability around the pelvis. But I do recommend that if you do use a pelvic support belt, that you also augment that with some exercises to keep the muscles strong. And then lastly, it's modifications to some activities. So making sure that if there are certain tasks that cause pain, we modify those. And at the end of today's presentation, I'll share with you some tips that you can download to help modify some of those activities at home. Sacroiliac pain. So this is pain that occurs where the spine and pelvis meet, which is usually right on either side of the low back. Typically, people will have pain more on one side or the other. This is essentially the same type of pain as pubic symphysis, but it's in the rear part of the pelvis, where the pelvis joins in the back part. And it's where the 2 wings of the pelvis meet the center stabilizing bone of the spine, called the sacrum. The activities that cause the pain are exactly the same as pubic symphysis pain. So it's typically anything that is going to be on one leg, or things like rolling over or getting up and down from a low surface. And again, the treatment is also exactly the same as pubic symphysis pain. We're going to work on stabilizing all those muscles around the pelvis. We can use a pelvic support belt to help cinch everything together. And then we can also modify some activities. So if anyone is experiencing either of those 2 symptoms, know that it is very, very modifiable and addressable with certain techniques to help create stability around the pelvis. The third type of pain is low back pain, very, very common in pregnancy. Usually with low back pain, different than sacroiliac pain, is it's a more broad pain that expands across the entire lower portion of the back and oftentimes spreads across both sides, whereas sacroiliac pain is usually on one side or the other. Many people will complain about that low back pain, particularly as the pregnancy advances, because of the weight of the belly pulling the back into an arched position. So oftentimes people will complain that the back pain is worse after they've been standing for a long period of time or walking for a longer period of time. I also hear a lot of complaints of low back pain in moms that have additional children at home because they're trying to lift those kids while they've got this big belly in the way. For managing low back pain, we do a lot of abdominal stabilizing exercises. And again, I'll share some of those on the next slide to help really reinforce and decompress the strain that's occurring on the back. I also love counter stretches to help. If you can imagine, when you're pregnant, your body is constantly getting pulled forward, which really arches the back and can strain those muscles. So we'll do a lot of counter stretching with bending forward, maybe child's pose where your belly can be between your legs to help open up that rear part of the back. And that really is helpful for creating space to allow those muscles to stretch and open up through the spine. And then lastly, we'll do a lot of education about spacing some activities out. So for example, if you have to grocery shop and you have to care for your child and you have a job where you're working on your feet all day, maybe you consider moving the grocery shopping to the weekend where you don't have to be on your feet all the time for work. So just kind of thinking of strategies of how best to structure your day to minimize the amount of strain on your low back. So in terms of exercises, certainly the thing I like to caveat anytime we talk about exercises with pregnancies, you certainly want to talk to your doctor first about your ability to safely exercise. So if you have a high risk pregnancy, you're going to want to just touch base and make sure that there's no signs or symptoms that you need to be aware of before starting exercises. The other thing to keep in mind is that when exercising, doing any of the exercises either listed here or, whether it's looking online for a program, talking to a skilled professional who can make one for you, you should never have pain while you're exercising. I like to tell my moms, my pregnant moms, this is your opportunity to start to build your mother's intuition for the first time. Listen to your body. If something doesn't feel right, then it probably isn't right for your body at that time. And I would reach out and find some guidance to help you with that. If something just doesn't feel right, maybe it's not pain, but you're like, that doesn't feel right. And your body will tell you. These are some signs that maybe you need some guidance with exercise, whether it's from a doctor or a therapist that can help you better understand your technique and how things are changing in your body. Monitor your exertion. So your body is certainly going to perform differently when pregnant. You're going to consume oxygen in a different way. Your muscles are going to fatigue in a different way. So a lot of times I'll educate my moms to use an exertion scale rather than think about the intensity that they used to exercise before pregnant. So an exertion scale is a really simple tool. You just imagine a scale of 1 to 10, 1 being like you're sitting on your couch watching Netflix, 10 being you're so exhausted, you're out of breath, and you can't take one more step because your body is so fatigued. For my pregnant moms, usually in the first and second trimester, you can work upwards of about 7 or 8 on the intensity scale because your body is still in a relatively condensed form. And you're working at, could be working at similar workloads. Certainly in late second trimester and third trimester, you're going to start to really feel those changes as your body takes on more weight and as things become significantly more stretched. And I often advise to back down that exertion to maybe about a 6 at most, being really mindful of how your body feels and certainly taking some breaks throughout so that you're able to make sure you're well oxygenated and well rested. So my favorite exercises for pelvic and abdominal stability are bridges, squats, split lunges, and planks. So a bridge is laying on your back with your legs bent, lifting your hips up and down off of the bed. It's a great way to encourage some great gluteal activation to help stabilize the rear part of your pelvis. A squat is the same as getting up and down from a chair. So I usually will tell people, imagine there's a chair behind you, send your hips back and stand back up. Before doing that, make sure you feel your abdominals tighten around your baby. Hug your baby close to you, then do your squat and move in and out of that position so that your hips can feel that motion of coming up and down from sitting. A split lunge is where you have both feet on the ground in a lunge position and then you lower down towards the ground and come back up. It's different than a moving lunge where you step forward and step back. So with pregnancy, we want to try to keep both feet on the ground, especially through second and third trimester. So keeping the feet fixed and moving in and out of that position can work a lot of the muscles of the groin and the hips to help stabilize around that pelvis. But we just want to be mindful that the feet stay on the ground and that they don't move in and out of that position. And then lastly, a plank, which is one of my favorite exercises during pregnancy. I oftentimes will recommend doing it on a raised surface, like a countertop or the end of the bed. And again, feel your abdominals hug around your baby and find that nice push-up position. And here you can add some easy challenges by tapping side to side so that you really feel that sensation of that abdominal tightness, creating good compression around the pelvis and the spine. Certainly, as we're preparing for delivery, we want to incorporate some aerobic challenges like walking or a light jog. If you're not a runner, this isn't the time to start, but a nice fast walk or walking program is a great way to work your blood flow to get you ready for the intensity of labor and delivery. But most importantly, and I can't emphasize this enough, listen to your body and make sure that as you're exercising, you're not feeling pain and you're not feeling overexerted. So let me pass off to Kerri and let's talk a little bit about how how acupuncture can help with pregnancy.
So one of the most common questions I get is acupuncture safe while I'm pregnant? And yes, it is. And it can actually help with a lot of things that people might not realize. So acupuncture has been proven to be safe and effective for pregnant women when it's done by someone who's trained and knows what they're doing, which I do. And what's nice is there are more studies actually coming out showing that acupuncture can be effective, especially for things like nausea and vomiting. It can help with heartburn and reflux, although that's in the third trimester, that's an uphill battle sometimes. But it can help with some GI discomfort like constipation and fatigue. And actually, there are some good studies out there about acupuncture being a really good option for women dealing with mental and emotional concerns like anxiety and depression during pregnancy. And also postpartum. Acupuncture can be a huge asset for women postpartum to help prevent postpartum anxiety, postpartum depression. And I can help with pain. So obviously when we're dealing with sciatic pain, pelvic pain, low back pain, I do have to be mindful of needling a woman differently when they're pregnant versus how I treat low back pain when there's not a baby. And I love pelvic floor physical therapy. So I'm constantly telling my patients when they have issues like that, get in with a physical therapist that is a pelvic floor specialist. Get in now when you're pregnant and develop that relationship. So then also postpartum, you have your support team that knows your body. And also acupuncture is, I think, kind of well known for working with breech presentation and labor preparation and also in induction. I treat that a lot. I love treating that. It's working with women whose babies are breech. At least I don't have exact numbers on this, but I swear at least half the time those babies do flip using moxibustion. So I'm going to talk about that a little bit later in a little bit more detail because that is something that is huge for women who want to deliver vaginally and their baby is breech. It could be devastating that they can't have the birth experience that they have in their mind. So I love helping women with that. All right. So I also didn't, really know if people watching this have even had acupuncture at all ever or knew what it was about. So I wanted to let people know what to expect during an acupuncture session. It's about 30 minutes with the needles in, maybe a little bit less, maybe a little bit more. But you should be comfortable while you're getting acupuncture. You'll be if you're laying on your back, obviously I don't want you laying flat for that time. So be propped up and comfortable and safe. You can lay on your side. I do have a pregnancy table in my office, so you can lay face down. There's this big little, it's normally hidden, but it's this big net, and it feels absolutely amazing to lay face down with your belly cradled, especially when I'm working on back pain, sciatic pain. It feels really, really good to lay face down. So I made sure I have one of those tables in my office. And the needles are sterile, thin, stainless steel. And hopefully it's not a painful process to get the needles in. You might feel some sort of sensation, maybe a little bit of pressure or distending feeling, but you should not be laying there uncomfortable and in pain. I always tell my patients, don't suffer in silence. Let me know what's going on. And yeah, you're laying, relaxing, maybe taking a little nap for about 30 minutes. And you come kind of as needed. If there's an acute issue going on, maybe I see you once a week. Or, in the first trimester, if you're not feeling good, a lot of nausea, a lot of vomiting, a lot of issues, I'll see people weekly. Second trimester, usually women start to feel a little bit better. I might only see them, like once a month just for some maintenance or if something pops up. And then acupuncture really kicks up in that third trimester, the last month or two before your due date, just for labor preparation, maybe the baby's breech. I always recommend, coming in weekly if possible, or every other week. At that point, you're going to your gynecologist a lot more often. So I always say, don't be stressed out about coming to see me. It should be an appointment that you're looking forward to. And also I utilize tacks. Tacks are actually brought them here. Tacks are an amazing tool for women who are nauseous in pregnancy, also anyone who's nauseous. But it is a little micro needle, and it looks like this, and you can place them on the body here. I'll actually show you if that's okay.
I'm like so intrigued. I can't wait.
So you can't even really see it. It's this tiny little, it's 0.6 millimeters. You can get it a little longer. I bought the long ones by accident and realized they hurt. So I got this size. And there's a little like plastic part over the needle, little like Band-Aid looking thing. And the nausea point is 2 inches above the wrist crease in between these two tendons. And if you're seasick and you wear those seasickness bands, that is stimulating this acupuncture point. It's pericardium 6. It's the 6th point on the pericardium channel that runs along the arm here. So I can needle it during a session, but what everyone usually prefers is to just get the tack and just stick the tack on there. And then you're tacked and it's in. And you can wear it for as long as it'll stay on. They can be up to a week. I tack the ears a lot for anxiety, for stress. Those stay in for quite a while, maybe a week or two. These just, especially nowadays, all the hand washing going on, these usually fall off in a couple days. Some women will put Band-Aids on them, or they'll wear their nausea bands over. This is just a lot more discreet than a big band. So people, if you're only 9 weeks pregnant and you don't want to tell anyone yet, but you're really nauseous, this is a lot more discreet than wearing a big bracelet and have people ask you about it. I have a few patients right now who when this falls off, their nausea comes right back, or they like one woman immediately started vomiting again when it was out. So then she quickly put them back in, and then it really, really can help reduce vomiting and nausea.
And I
All
will
right.
say one thing that's not on this slide, Kerri, that I'm going to just give you a shout out for is having been to Kerri myself as a patient. The thing that you can also expect during an acupuncture treatment is really awesome information. Kerri is really forthcoming in explaining, why she's doing what she's doing. It gives you a really nice sense of control and understanding about what's going to happen. So I think that's one of the things Kerri is remarkable at, because you leave there a more educated consumer of your own body. And I think that's really important to note.
Oh, thank you. Thank you. I always say I don't want my patients to feel like pin cushions.
Right.
I want them to know what I'm doing and have an understanding. So, thank you for those kind words. Um, the breech stuff. Okay. So, um, so acupuncture can really help sometimes, and it's a really safe and effective and benign thing to just try. Why not? Why not try moxibustion? If it works, great. If it doesn't, at least you sort of tried everything. You can start treating breech presentation around 34, 35 weeks. And I'll show you the moxibustion, but it's really to be done almost every day until the baby flips. And you can keep trying to move that baby up until week 38, 39. But at a certain point, if that baby is just locked in its position, it's locked in that position. And I think, if the baby is, sometimes there's a physical reason why that baby is not head down. And acupuncture is a really safe option because it's not going to force anything to happen that's not naturally meant to be. I had a patient who texted me after her baby was born, and she said, it turns out the cord was wrapped around its head. That's why the baby just didn't flip. And it's like, acupuncture was done, no harm was done. It's meant to be something that is super gentle and safe to try. So you can do acupuncture to try to open up the hips, and there's other things we can do, but really the main thing that is done is moxibustion. Moxibustion is an herb, it's mugwort. In Pinyin, it's Aya, and it's used on an acupuncture point called, is it Zhuyin? I'm botching the Chinese pronunciation here, but it's the urinary bladder channel, the longest channel in the body from the eye socket down to this last point here, urinary bladder 67. It's a large channel that actually runs all the way down the back. So I needle it a lot for back pain, but it ends on you can see it here in the picture, the lateral corner of the pinky toe. And you hold, it's like a large incense stick, and you hold it about an inch away from this acupuncture point for about 20 minutes each side. And you want to do it daily for about 10 days or so, until the baby flips. And there's other types of moxibustion that if someone comes into the office for a full treatment, I'll do full treatment 30 minutes with the needles, also do moxa. But it's also great because it gets the partners involved. And because it's very difficult for a pregnant woman who's probably 36, 37 weeks pregnant to reach down to her foot for an extended amount of time. So I always encourage the partners to get involved, and it gives them something to do. And I find that it's nice for the partners. So I've gotten that feedback. And if the baby does not flip, some of my patients still choose to do a manual version that the OBGYN will perform. And some of my patients that were really good about doing this moxibustion every day reported that the manual version was not uncomfortable, and it was quick, and they ended up with a really quick vaginal delivery. Sometimes the manual versions can be painful, but preparation leading up to made it less so. Um, so labor preparation, which is different than induction. And labor preparation really is just getting you guys ready. Some people get a little anxious, get a little nervous leading up to childbirth. Um, and it's just a great way to relax the body, lets the baby know mom is ready and relaxed. And the less stressed the mom can be, the more relaxed we can be, the more we can calm that nervous system down. It lets that hormone cascade flow a lot more smoothly. So then labor can start and progress if it's meant to be. Again, just like breech presentation, acupuncture is never going to force anything on the body that isn't meant to happen. So it's not like I'm going to cause labor to happen if it's really not meant to be. At the end of the day, it's up to the baby. And acupressure also is used too. And that can be done again by the partner. It gets them involved. A woman can do some points on her own. And I always give my patients a big packet. My favorite, um, one of my favorite books by Deborah Betts, Acupuncture in Pregnancy and Childbirth. She's great. And she has a lot of YouTube out there. She has an app. I always guide my patients to her acupressure techniques for labor preparation, for induction, also for pain during labor. She's great, world renowned. There's some other great ones too that I've listened to lectures by. But it's a great way to either like you always said, the mother's intuition starts. And I always tell my patients to, kind of get in touch with your body and listen to your body, what's going on. Work with your partner on what feels good, what's helping. And it is a really great way to involve them. And also some of the points that you learn while you're doing labor prep and induction, when you're in the hospital, you can utilize too.
Absolutely.
Yeah.
And, certainly between a lot of the tips that Kerri has already shared with regards to acupressure and acupuncture for labor prep, there are other physical things that you can do with your partner to also prepare. And oftentimes when I meet someone who is pregnant, I will treat them for whatever their pain condition might be at the time, but then I also advise them to come back for an appointment around their 8th month. And during that appointment, we talk about vaginal stretching. And a lot of people are always like, what? What do I have to do? And especially for first time moms, this is a really great tool. Again, your partner can be involved with this. You can do it yourself if you're a little more apprehensive. But essentially, we're preparing the vagina to be able to stretch to deliver the baby. And this being very proactive with vaginal stretching before delivery can minimize your risk for tearing or a need for episiotomy. So it's a really nice option that we can start as early as 34th week, where we can go in and either manually stretch the vagina by a practitioner, or like I said, I can train your partner to do the manual stretching with you, or you can do it yourself. It's a really great way to start to build that connection to get ready for that delivery. Certainly, we already talked about the aerobic component of labor. It can be very physically demanding and require a lot of breathing control. So, making sure that your cardiovascular system, your lungs, and your heart can meet that demand is really helpful, especially as we get larger in that 3rd trimester. We want to stop moving. And this is really the time to allow your body to continue to work so it is ready for labor and delivery. A lot of times at that 8-month appointment, I work with my moms to teach them how to push. Pushing a baby out is not something that you are necessarily born with. It's not a skill that everyone possesses. So I will train them on how to push, how to coordinate what that feels like, and then use a mirror to help get the feedback. Because you can imagine, we can't always rely on sensation, especially if your birth plan includes having an epidural, because you won't have any sensation there. So I'll teach you how to use the mirror to judge your performance and coordinate that push to help minimize that risk for need for cesarean because of inadequate pushing. Certainly, as you're preparing for this delivery, seek out a professional like Kerri, like myself, that can help answer some of your questions to help you feel in control during this time where it often can be very overwhelming, especially as you near that delivery time. And then most importantly, like Kerri and I both have already emphasized, is having a postpartum plan. Oftentimes when we're pregnant, we think the end game is that delivery. Oh, the baby comes. But actually having a good postpartum plan with a postpartum team, whether that includes your OBGYN, an acupuncturist, a physical therapist, a massage therapist, whatever that is, a lactation consultant, you want to have your team available so that you can manage the anxiety component, the depression component, the physical component, the pain components, all of those different pieces. There's a professional out there that can help provide that guidance. So if you don't have that network, reach out to someone like Kerri or myself, and we can help connect you with other people in the community to provide that guidance. Because really, certainly, we want to pass the word on about PT and acupuncture, but most importantly, we want our moms to feel like they have access to the information they need to be successful during this time. So, in conclusion, pregnancy shouldn't be painful. You should feel like you have the ability to have the control over that pain, whether it's through exercise or acupuncture, whether it's a massage, whatever the case may be. We want you to feel that you're able to have that fantastic pregnancy and maintain a good level of fitness through exercise to help improve your delivery and improve your success with carrying that baby through the 9 months. Acupuncture is so fantastic for so many reasons, but certainly in helping to manage pregnancy-related issues, as Kerri indicated. And we're really here to help. That's why we want to have this presentation today, to make sure that people understand that there is help available out there. We are going to open up for question and answer, but before doing that, I did want to share, if you're interested in some of those pregnancy tips, how to reduce pain during pregnancy, please check out this free download. It is just a bunch of different tips for how you can set up your home or set up your activities to help minimize any kind of back or pelvic pain. And also here you'll see mine and Kerri's emails. We both offer free consultations. I know in our clinic, we are doing virtual appointments as well for those that are apprehensive. Kerri, are you also doing that, virtual appointments, or just in person?
It's really just in person, although I will do sometimes like new patient consultations in the over the phone, or virtual, so it's not as much time in the office.
And certainly we're both available via our email to answer questions about resources or any issues that you might be having, and then we can help kind of triage you where you need to go. So with that, I'll open it up. If anyone on the call currently has any questions, you're welcome to unmute and fire away. I'm going to stop the recording just in case anybody would prefer their questions not to be recorded.